Hello, welcome back from lunch, everyone. I hope you got your physical and other needs taken care of so we can have a wonderful afternoon and continue the Eco Summit. My name is Sunny O'Rourke, and I am a fourth trimester Arizona board member. As former executive director of the Idea Museum, I am passionate about parents and children and their development in body, mind, and soul. In my current work with O'Rourke Consulting, I work with nonprofits to achieve success through compassionate listening, strategic planning, and customized solutions for higher mission impact. I first became involved with the wonderful fourth trimester Arizona in 2017 when we hosted the first ever fourth trimester village at the Idea Museum. We have continued our partnership through the years, and I am so proud to be a board member today. Our next session is Infant Feeding in the Southwest, a Tale of Two States. But first, let's talk about Zoom etiquette. By now, you're pretty well versed in this, but just in case someone is joining us for the first time, before we begin, we want to go over just a few notes regarding the use of Zoom for our sessions. For those of you who have been here all day, this is just a reminder, as others may have joined us later, as I mentioned. First off, our summit today is being recorded. We ask that you please keep your microphones off while the speaker is speaking. You are welcome to have your cameras on or off throughout the day, but we encourage you to have them on when asking questions. Plus, we love to see your beautiful faces. We will have Q&A portions at the end of each session. For those times and for sessions that are more interactive, please use the hand raise emoji to request to speak. If you need help, the name of the tech support person will be near the top of your chat box in each session for you to direct message if you have questions. The chat is also a great way to interact with other attendees in your sessions. And please review our legal disclaimer also found on your screen. Here are our financial disclosures for this talk. We are full of gratitude for our presenters for this session, Amanda Singer, Irian Coronado, and Dr. Jenny Beaver. Amanda is one of the charcoal-streaked, red running into the water clan. Born for the one who walks around clan, her maternal grandparents' clan is Big Water Clan, and her paternal grandparents' clan is the Many Goats Clan. She is a Navajo woman originally from Coal Mine, New Mexico, and currently living in Fort Defiance, Arizona. She has been married to her husband, David Singer, for 21 years, and they have 4 beautiful children, Bradley, Roger, Micah, and Nitshoni. Amanda supports Navajo families, excuse me, as a certified lactation counselor, Indigenous breastfeeding counselor, and lactation advocate for the past 16 years, and as a Navajo doula birth keeper for the past 3 years. She is the executive director for Navajo Breastfeeding Coalition, Dene Doula Collective. She is also the co-lead of the fourth trimester Indigenous Parents Support Village. Her support services are virtual Navajo nationwide, and her in-person support is in Window Rock, Arizona, and surrounding communities. Irian is a maternal child health epidemiologist at the New Mexico Department of Health in Santa Fe, New Mexico. She leads New Mexico PRAMS, which is a Navajo PRAMS project, along with Del Yazzie of the Navajo Department of Health. And they work with many data consumers and public health advocates to increase visibility of maternal and infant health needs and strengths across New Mexico, Arizona, and Utah. Ms. Coronado's team, including Lindsay Pinto, work to facilitate data sharing, analysis, and public health policy across the jurisdictions. Dr. Jenny Beaver holds her doctorate in biology from UC San Diego and a BS in biochemistry from ASU. In addition to her nonprofit work, Jenny works as an international board certified lactation consultant at the Arizona Breastfeeding Center. Thank you all for being here today. For today's presentation, Ariane will first present information about breastfeeding rates, and successes in New Mexico. Amanda will then take the stage to talk about the work of the Navajo Breastfeeding Coalition that spans the entire Navajo Nation, including Arizona, New Mexico, Utah, and Colorado. Jenny will then give us some information on the barriers we are seeing to breastfeeding in Arizona. Following their brief presentations, we will open a panel discussion with all three speakers. Take it away, Ariane.
Thank you so much. I go ahead and share my screen. Make sure it's being viewed.
We can see it.
Okay, thank you. Thanks for that introduction. Really appreciate being a part of this today. And I'm going to talk about some breastfeeding trends among Native American women in New Mexico from 2000 to 2015. So since the information is old and we're talking about things that have been we've been tracking for quite a long time, just want to let you know that we're interested in your input for one of many reasons. One is that we are updating this information for a more current period. And so very grateful for this opportunity to present with colleagues and acknowledging the co-authors on the analysis that we worked on in Dualuwalia from the Centers for Disease Control and Prevention, and Del Yazzie, who is my co-PI at Navajo Epidemiology Center, and now moving up on the ranks, like he's not even in the epicenter anymore, but he's still a co-PI on the surveillance. So please don't use any of this information. Don't take screenshots or anything without checking with the tribal epidemiology centers. Although we're not going to be sharing tribe-specific information, we do look to them for permissions, and we are approved by the institutional review boards for our public health surveillance at the CDC in New Mexico, for the New Mexico State University and the Navajo Nation Research Review Board. And I want to start with some acknowledgements to people who have contributed to the information that we're sharing and some of the conclusions that we have made about our findings, and those you'll see on the screen represent a lot of different people from the tribal epicenters, from a community advisory board that was put together by Envision New Mexico, as well as some providers in Indian Health Services and with the Zuni-WIC program. Oops. So PREMS, many of you may be familiar. It's a U.S. CDC cooperative agreement with states and jurisdictions for a standardized surveillance of live births, and that's to understand different outcomes of how we can improve both maternal and infant health in the United States. And New Mexico State and Navajo Nation have been operating under one shared study since 2005, as well as our partners in Arizona and tribal PREMS in New Mexico have been operating since 2016. So when we started looking way back, because we had been conducting the surveillance for many years in New Mexico, we were really excited to see some positive trends and upward movement for all women in New Mexico that corresponded with policy and program changes and support at the community level. But we also acknowledge that many of the gains in the prevalence of breastfeeding initiation and in different areas of duration were really showing improvement among Native American women that were participating in the PRAMs. Sorry, I'm having a weird thing with my mouse here. So looking into what we thought were some of the drivers of these improving rates in New Mexico, we had a breastfeeding task force that was very active in limiting the distribution of infant formula gift packs in hospitals and birthing centers. That took place in 2000. In that year, hospitals agreed not to just automatically give the the formula packs to birthing people. The state of New Mexico passed legislation.
Can I interrupt you for a
yes.
sec, Arian? I don't
Yes.
think your slides are advancing, and I know they're amazing, so I'll make sure they do.
So you're not seeing the. Okay, sorry. Let me try something else.
If you go at the top from the beginning where it says or current, it'll start the slideshow from the beginning, and then you can just tab over to the slide you're currently on.
Okay, let me.
I wonder if it's the screen, because I saw her do that.
Yeah, let me try again from current slide. Now are you seeing acknowledgements?
Yes.
Okay, and then is it moving for you now?
Nope.
No.
Oh. Okay, maybe. Trying to see if there's a button here that helps. Not really sure what the. Well, let me try this. What are you seeing now?
We're seeing your slides as it stands for editing, not for presentation.
Wonder if you stop sharing, like, yeah, maybe, yeah, stop doing like the presenter view and maybe just go down on the slides. That might work. PowerPoint is odd sometimes.
Huh, okay, yeah, let me. Go to. Sorry about that. I'm gonna have this kind of. See now. Okay, I saw it say it was sharing, but then when I move to the next one, I don't see anything.
If you
put it in full presentation mode before you share, it should be okay. It's still in editing mode.
Yeah, well, it was in that to begin with. So let me.
If you just click the slides on the left-hand side, when you and we can see them move. That way, if you just click one at a time. Yeah.
Okay.
Like we see acknowledgements now.
It's working. Okay, thank you. Yeah. Let me
Mm-hmm.
just keep going with that. Sorry about that.
That's okay.
So getting back to what we were looking at in terms of the improving rates, now at least I think you can see my slide with the figure of breastfeeding initiation duration to 4 weeks and 10 weeks. And then it's taking us through that period of 2000 to 2015 births. And we began looking at some of the possible impacts and interventions that might be helping with these improvements, starting with that ban the bag that I talked about, state of New Mexico legislation for a flexible workplace for pumping and breaks in the workplace that preceded the federal legislation. And then we saw some expansion of peer counseling programs around 2011 through WIC and other community partners that we felt like might have made some impacts, as well as then over different years seeing more baby-friendly hospital designations, different hospitals in New Mexico achieving that designation. So we didn't really, pinpoint which things affected what specifically, but we had this idea that all these complex and comprehensive policies and programs were making a collective impact over time, and the trend matched to some degree what we were seeing at a high level. So one of the things that happened in New Mexico, Zuni was the first hospital to achieve the designation. And so it was both encouraging and impressive to see different facilities taking that on. And we wanted to learn more about what was actually happening at a more statistical level population view that we could try to understand and tie to some of the activities that people were working on. So overall, we saw these we broke it down into 2 different time periods to look at the characteristics of people that were initiating breastfeeding in the Native American cohort. And so you see that from 2003, that was time period 1, to 2012, 2015, that was time period 2. And we had this pretty significant percentage change from one period to the other, about 10% increase in initiation from the time period 1 to 2, and about 15% increase for breastfeeding through 4 weeks, and 10% increase for 10 weeks duration. And in pounds, that's about as far as you can go due to the timing of the survey. And then we looked at some of the different characteristics that of the women in our study and what that looked like for age and different demographics to establish some kind of modeling that we wanted to do. And so ultimately we did some logistic regression and kind of typical epidemiologic style, but we wanted to see if we controlled for all those different demographics and other characteristics and experiences, what we would learn. And what we found was that that WIC had some predictive value that was really significant for people who continued to breastfeed at least 10 weeks. We also discovered that younger women were gaining more than older women, which is kind of the reverse of a lot of positive health trends that you might expect. We found that some things, depending on the time period, whether it was initiation, 4 weeks or 10 weeks duration, didn't seem to have a lot of impact that you might expect would. And so we felt like what was really important, what was standing out was this WIC participation, and that there were things that we could probably drill down more about and learn either through qualitative information, informant interviews, and some of the focus groups that was going on with our partners. And so some conclusions that we've made so far is that there really was a multi-system program and policy impact in New Mexico. We have since learned that the peer and community-based lactation support has been integral to sustain breastfeeding promotion efforts. We did find through some of our partners and focus groups that people did feel supported in WIC, and depending on whether it was a state or tribal WIC program, there was differing degrees of feeling supported and encouraged. And then we didn't have a lot of accompanying information about policy, so that's one of our next steps, and specifically looking into policies of family leave, paid family leave or unpaid family leave in New Mexico and Arizona. So I'm going to leave it there and pass it over to Amanda, and appreciate the opportunity to speak about these findings.
Thank you so much, Ariane. Amanda, the floor is yours.
Okay. Okay, yeah, everyone. I am Amanda Stinger again. You heard my introduction and my brief bio earlier, so I'm not going to repeat any of it. And I will be presenting on how the coalition supports Navajo families. Next slide. And it's still on the, okay. And for myself individually, I have no financial interest or relationships to disclose. Next slide. The Navajo Breastfeeding Coalition was founded in 2008. And we basically cover the entire Navajo Nation, which overlaps 3 states, which is approximately 24,000 square miles. And the population is approximately, or the census actually, registered Navajos is about approximately 400,000 plus. And then breastfeeding advocates and Indigenous birth workers from the community, WIC, and hospitals, and that's basically who we are comprised of. And then we also created an extension program, which is the Dene Doula Collective of 2019. Next slide. So some of our objectives that I would like to share is that we strive to build and strengthen relationships between community members, community agencies, professional associations, and government entities supporting birth work. To promote and increase public acceptance of the benefits of breastfeeding and traditional birth work, and to promote behavioral change that results in increased rates of breastfeeding initiation duration and reduce maternal and infant mortality rate. To promote and increase acceptance and support for breastfeeding in schools and work sites, to educate healthcare providers about cultural breastfeeding and birth work and its benefits towards decreasing maternal and infant mortality rates, to educate Indigenous birthing families about informed choice / consent, and to promote health equity by bringing awareness to the effects of historical trauma on the health of Navajo families. And last but not least, to promote healing. Next slide. So our vision and mission statement, which we actually we revised, I believe it was in 2021. And our vision statement basically states revitalizing our Dene culture as a community-centered organization by advocating as a community-centered organization by for all families in supporting birth ceremony and babies for sacred food. And our revised mission statement is now the mission of Navajo Breastfeeding Coalition is to improve the health of Navajo families by providing compassionate, unbiased, and accessible care to improving all birthing families and infant health through holistic traditional practices and to promote healing. Next slide. So some of our work that we've been involved in, and this is just all in a nutshell. I could go more in depth with this, but due to time, I just bulleted everything that we basically have done. We're working on normalizing human milk as a first sacred food, reintroducing cultural birth workers on Navajo Nation, which is just basically
Mark, how are you, my love?
Bringing awareness to what a doula is and what our role is, and then also bringing awareness about what our role of the provider. Can someone mute that, please? I'm getting kind of sidetracked on hearing the background noise. And revitalizing and preservation of cultural prenatal.
It is just crazy. Hey, Marcus.
And feeding practices. And then also we're actually really going out there and doing more community outreach and education. So you'll see us more out there. I'm still on the first slide. The slide previous to this. No, go backwards. One more. There you go. And so you'll see us like at health fairs, and sometimes we'll try to catch as many tabling events we can to bring more awareness to who we are and what our cause is. And then we are also working towards partnering with communities, professionals and politicians in Navajo communities, and then also within border towns. And then we also are working towards promoting and increasing public policies that support cultural birth work. And that encompasses like reproductive health, reproductive justice, perinatal health, all of that. And then we're also working on, again, reintroducing several breastfeeding awareness activities that we've been involved in, like within the pre-pandemic. So since when everything began to open up again, we've been actually doing more to spread more, to actually bring more awareness to breastfeeding, our breastfeeding support efforts and breastfeeding activities. And then one that just currently recently happened in August is the Navajo Nation breastfeeding proclamation that was signed and acknowledged by the Navajo Nation President Boone Nygren. And we're also working on creating cultural congruent birth work and lactation education material. And we've also established an electric breast pump program for Navajo and other Native American parents. Next slide. And then just a work continued again. We have direct support services where the coalition has like direct support for lactation support providers, and then also doulas. And we've been involved in research support, and currently we're in the planning stage for two other research projects, which I did not list on here just for the sake of time and also for the lack of space. But currently you'll see our contribution in the elimination of formula sample pack distribution in Indian hospitals, and then as well as the Latch Project, which is the breastfeeding project, which we did in collaboration with the University of Utah, Utah Navajo Health System, Utah WIC, and of course us. And then some policy and advocacy work that we've been involved in is the passage of the Navajo Nation Healthy Start Act of 2008, and then also we were involved in the Navajo area IHS designation of the baby-friendly hospitals. Next slide. And then just potential overall outcomes. We're working towards normalizing and revitalizing that human milk is a gift to the Navajo people from the Holy Ones, and that returning to Navajo cultural birth practices opens the spiritual gates to healing for future generations. We are also working at educating the community so that they can understand the role of cultural teachings and cultural healing practices, so that they can help navigate overall health and wellness, and then normalizing using ceremony as a way of life to retain balance through mental and physical healing. And then NBC reinforces the Navajo traditional practitioners' teachings on having our children self-identify as Dene. This allows young minds to know who they are and where they come from, and then meeting the needs of lactating employees and parents by providing optimum support in community settings, hospitals, businesses, etc. We are also working towards promoting integrative medicine as a vital form of patient care to healthcare systems. Next slide. And that's just a group picture of some of our direct support providers. And if you kind of look towards the back, you'll see First Lady the First Lady Jasmine Blackwater Nygren. And she was actually took part in our April healing retreat for birth workers. And this was the night that we had a celebratory reception for them, and she joined us, and she actually came into our picture and took a picture with us. Next slide. And this is my contact information. So you're up, Jenny.
Thank you so much, Amanda. Jenny, it's all yours.
Thanks, Amanda. And I apologize for not doing such a great job of doing your slides for you. Here we go, share screen. Our lawn service has arrived right as I'm going to present. So, you know, it's the bane of the Zoom presentation. So here we go. All right, my name is Jenny Beaver, as most of you probably know. Are you seeing my slides advance?
Yes.
Okay, perfect. All right. And I, in addition to my work with Fourth Trimester Arizona, am also an international board certified lactation consultant. And I felt like I needed to say a little bit about what that was before I describe some of the things we're talking about today, because I wasn't sure that everybody knew what that is. So this is a picture of my colleague, Kimberly Morsalis, who is also an IBCLC, and she looks way cooler doing it than I do. And I love this photo, so I put her up here. But I wanted to just describe what we do. So as IBCLCs, we're breastfeeding clinicians, and our certification requires health and counseling courses, 95 hours of lactation education or more, and 500 to 1,000 hours of hands-on clinical experience. And we have to pass an international exam in order to become an IBCLC. In this role, we may be hospital-based, WIC-based, or in private practice. And in the hospital, our services are usually covered by the global OB care. Outside of the hospital, our services may be covered by private insurance or WIC or other types of programs. I am so excited that we got to bring the three of us together to talk about infant feeding here in Arizona, because I feel like there are some pain points for us in Arizona that New Mexico has gotten figured out, and I'm excited to get to talk about that. So I'm going to talk to you about the infant feeding rates in Arizona that we're seeing currently. These are from the breastfeeding report card from the CDC in 2022. So 85% of parents start out breastfeeding. 58% are still breastfeeding at 6 months, and 40% are breastfeeding at 12 months. A lot of what enables parents to continue breastfeeding as long as they desire, or chest feeding or body feeding or pumping milk for their babies, which is all considered breastfeeding, is the ability to receive support throughout that duration of infant feeding. So I created this chart to talk about where Arizona parents can receive support for breastfeeding and who pays for it and what's covered by it. So in the hospital, private insurance and access plans, our Medicaid agency, are able to pay for that through that global OB care. If a parent wants to see someone outside of the hospital once they leave, which is when most of their breastfeeding experience happens, they have a lot of different options, but not all of them are available to low-income families who may have access. So private practice IBCLCs, we are not currently covered by access at all. In fact, lactation at all is not covered by access. And so parents who have access are unable to get that level of support, which is actually available to the majority of people with private insurance, as it was part of the Affordable Care Act in 2012. So whether they're in a private practice or they are in a pediatric office, that office won't be able to bill access for that lactation consultant, and it'd have to be somehow bundled into a different visit. Parents who are low income and have WIC support can receive breastfeeding support through WIC, depending on the WIC agency. Some have a lot of peer support services, some have a lot of IBCLCs, and some have very little. And then some of the home visiting programs in the state do cover lactation consults, and that's generally because the people who are doing the home visiting have become IBCLCs or certified lactation counselors, CLCs. The barriers to receiving that support in Arizona, there's a lot of them, and this is stuff that we run into in our private practice every day. Insurance panels may not credential IBCLCs as providers. There are several insurance companies who continue to refuse to do this, and they're private insurance companies. And that makes a huge barrier to patients who need to see support and can't do that through their insurance. Our state Medicaid program access does not cover breastfeeding support and counseling at all. And parents report difficulty receiving a breast pump from their access plans a lot. And I will say that in our breastfeeding center, we do low-cost visits for parents with access. And we started collecting pumps for these parents because they so often had challenges getting getting pumps from their access plans. And that was something one of our consultants, Erica Glaze, actually took it upon herself to do. And I think that that's pretty common for lactation consultants to see that here in Arizona. Remember, 51% of Arizona births are covered by access. So this is a huge amount of new babies and moms who are not able to get that type of support that people with private insurance are. And WIC, as much as they are amazing and do amazing work, they were never created to provide breastfeeding support for 51% of families. In several Arizona counties, a single contracted IBCLC is the only IBCLC available to all those WIC participants. I'm sorry, these slides are coming out so funny. Where can Arizona parents get a breast pump? So this is the next question. So most of the time when you have private insurance, the insurance company will tell you to go to one of these companies, a DME company, some place like Aeroflow, and put in your insurance information, and then that company will come back to you and give you all your options and send you a breast pump. And that is true for people who have private insurance. For people who have access, unfortunately, it doesn't work that way. And I apologize that I put the X in there. They have to go through a different type of process that sometimes requires a lot of pre-certification. And that, I believe, is part of the problem that my patients have seen when they are trying to access a breast pump, is that the number of steps that are required are just too many, or they weren't given the information on how to even complete the first step. And so rather than doing that, they go buy a retail pump, often at large cost, or they get a borrowed or donated pump, some of the things that we were talking about. On the Navajo Nation, they've been doing some great work with the Breastfeeding Coalition to get pumps for people who need them as well. And I apologize. The lawn service is now following me to this room. So the barriers that we often see to receiving a breast pump in Arizona are that private insurance plans they're required to provide breastfeeding equipment per the Affordable Care Act. And most will do it with a service that contacts their insurance plan. The access plans are required to cover the breast pumps. And in practice, they should do that. But what we see is that parents report significant challenges. Again, 51% of Arizona births are covered by access. And WIC may provide breast pumps to low-income mothers, but there are some caveats with that that make them inaccessible to some moms, and different WIC programs may have different policies. Parents shouldn't have to struggle to reach these breastfeeding goals. The Affordable Care Act was put in place to make sure that that didn't happen, and yet we're still seeing so many challenges in Arizona. I've been floored in my conversations with Amanda and Arian about the differences between Arizona and New Mexico in the way that Medicaid delivers breast pumps. And so one of the pieces of this Access Maternal Mental Health Advisory Committee was the recommendation to expand lactation coverage, including pumps. And so I'm very hopeful that as we start to move forward with maternal health, we're able to begin to make change in that direction. We're going to be talking more about this tomorrow as well. And that's all my slides.
Thank you so much, Jenny. That was wonderful. So now we would like to bring up all three of the speakers for a discussion. This is time for the questions, if you haven't already put them in the chat. Okay, our first question is for Amanda. On the Navajo Nation, you're in a position to see the differences in breastfeeding policies, support, and provision of breast pumps across both Arizona and New Mexico. What are the most impactful differences you have seen between Arizona and New Mexico in terms of breastfeeding support and breast pump coverage?
I know with New Mexico, we don't really have much of an issue, or really don't have a lot of demand for electric breast pumps, just being a community organization that has funding to purchase breast pumps. And normally, even with the breastfeeding support efforts on the New Mexico side, we've been invited into certain spaces to actually talk about what we're seeing back here on Navajo, and then the considerations are discussed, and then you see a lot of the change that's happening. So a lot of New Mexico, they include community organizations, nonprofit organizations to work alongside government entities. And on the Arizona side, we do have the benefit of receiving funding from ADHS, which is Arizona Department of Health Services, for breastfeeding support supplies. So we're able to use that funding towards purchasing pumps for Arizona, our Navajo residents, but it really is there to support all 21, 22 tribes in Arizona. So we actually do help. We've helped relatives like in Hopi and I believe it was White Mountain and San Carlos, when they've found out that we will provide those pumps for them as well. And just seeing the differences as well with Arizona, we don't really, we aren't really invited to certain tables like we are in New Mexico. So I think that's where a lot of the disconnect is. I mean, you can see even the breastfeeding rates, there's a huge difference. There's a higher instances of breastfeeding initiation and then also breastfeeding duration in New Mexico. But I also believe that's partially because you have the community organizations that are included in, again, in serious and discussions, like, you know, especially like around, right now we are working within the New Mexico HSD and New Mexico Medicaid to revise a language around the lactation support reimbursements, as well as we actually help them build from scratch the doula reimbursements with New Mexico Medicaid. So so that's, you know, I think a lot of that has to do with the differences between New Mexico and Arizona. And in Arizona, it's just like I feel like a lot of us in the northern part of Arizona are essentially ignored, it seems like, or we're invisible. And I really would like to get more of our coalition members involved with a lot of these policy writing, and a lot of you know, work around different laws that will also promote and protect lactation and breastfeeding support. And then also with IHS as well, like with the billing, what I've seen is that, especially with the bordering hospitals, like we have Northern Navajo Medical Center and Gallup Indian Medical Center, who do provide services for both Arizona and New Mexico residents. And normally they don't have any issues ordering breast pumps for New Mexico residents, but usually, especially once they found out, those two hospitals, when they found out that we were actually, we had funding to provide breast pumps for their Arizona patients, a lot of the referrals are beginning to come to us. So even there, you know, and I've been asking like the different, asking them why, you know, what are you running into? What's causing the delay in breast pumps? And there's just so many things. Like one is just basically their criteria, the requirements. They have the patients have to, you know, they have to have certain conditions and to get the access breast pumps, which essentially they don't qualify, you know, from what I'm hearing back from certain providers. And then also some of these DMEs require a physical address, but if you look back on the Navajo Nation, really nobody has a physical address. And we don't have any like address system out there, out here on the reservation. So I know with the DME that we work with, which is Worthy Medical out of Georgia, we had to justify with them because they did at first initially require us to have or our clients to have physical addresses. However, we justified to them about how that's going to be a barrier. And we said a majority of our clients have PO boxes, post office boxes. And so we were able to justify that for our clients. So now the breast pumps that we order for the individuals who requested, a lot of their pumps go to post office boxes. So, you know, there's a lot of things that are coming in that are, and then the feedback that I've received from several IHS is that they have never, ever been able to get a breast pump under the Access program.
Thank you very much, Amanda. That's sad. A lot of work still to be done. Okay, let's see. We have another question that is for anyone on the panel that would like to answer it. How did the pandemic and formula shortages amplify the problems you saw with equitable access to breast pumps? Who would like to address that first? Just go ahead and unmute and dive in. Jenny looks like she's unmuted.
Actually, I was going to say, Amanda, do you want to take that one?
Yeah, sure. Oh my gosh. During the pandemic, I know my group, we've also experienced our own secondary trauma from the support that we gave, and then the call out for help. And one of the things that had occurred was basically, and everybody here probably does know this, that the support efforts from the hospital as far as providing breastfeeding support just halted, you know, just due to the pandemic. And so because of that, we were, a lot of our community members began to reach out when they began to hear who we were, whether it was actually from maybe providers that know that we exist, and then, or that they just randomly saw our Facebook page. And they reached out and they began to ask for support. And one of the other things that we had also ran into was just some issues around like the infant formula shortages. It magnified a lot of what I think a lot of people overlooked in the past. Is just the how it was really difficult for individuals, especially back up here in Navajo, to acquire a breast pump from both WIC and then again, the barrier from not acquiring one from Access. And so we had to do a lot of, answer a lot of calls from parents who were concerned and worried. And sometimes they were literally crying on the phone saying, how can we get help? We need help. My baby's out of formula. And then sometimes, you know, they were saying like, they would tell us that, you know, they were not given a pump by, let's say, WIC, and then they reach out to us and ask us if we can provide them a pump. But by that time, they're literally maybe 3 or 4 months out from when the last time they latched on their baby. And then we would have to educate them and let them know, you know, it's going to take about 3 or 4 months for you to reestablish a healthy supply. And I said that, you know, the pump isn't something that is a miracle worker that went to that first pumping session, all of a sudden you'll have an abundant supply. Literally, you have to work to building a healthy supply again. So that's one of the things that we had to do and re-educate, but also being, you know, even though we are a breastfeeding coalition, we began to actively look around for infant formula for these families. And that also goes back down to a lot of these families I knew because they initially began or wanted to breastfeed. And then also a lot of our members knew them, but because they went back to the work and then their employers were not supportive of them, they were literally forced to give formula. And then a lot of these families or parents were directly impacted by this. And
thank you, Amanda, very much. We appreciate that information. I'm so sorry to interrupt, but we're now at 1:20, so we've gone a little bit over and people might need a quick break. So Jenny, how would you like to do this?
Yeah. Thank you so much, Amanda and Arian, for your presentations. I really appreciate it. This is an ongoing issue. I think, why don't we take about 3 minutes and then take a break if you need to go use the restroom, and then we'll get started with our next session. Those of you who are joining us and have information on this particular issue and want to reach out, Kate Dobler has been messaging me and saying that Access would like to know who the patients are and if they're having trouble, so that they can begin to troubleshoot and figure out where those issues actually are stemming. So if anyone else is seeing this, and I can't imagine you're not, if you're in the lactation world, please please reach out to us on chat, or you can reach out to me on Whova and we'll get that taken care of. Thanks so much. And thank you again, Amanda and Arian. This was such a great presentation.
Yes, and just a few reminders before I move into this couple of minutes break. Don't forget to be active on the Whova platform. Take a look at our leaderboard to see where you land. Not only can you build your network and connect with others, you'll earn points. Check out the Win a Prize tab to learn more about our awesome prizes. So we'll take a couple of minutes break and we'll see you. Let's say we'll get back at 1:25 to start the next session. Thank you, everyone.